Measles. Measles was declared eliminated from the United States in the year 2000. It is not solved. The measles virus is the most contagious respiratory pathogen ever documented, with a transmission rating between 12 and 18, meaning one infected person exposes between 12 and 18 others in an unprotected population. Maintaining elimination requires 95% vaccination coverage. In American kindergartens, that figure fell from 95.2% in 2019 to 92.7% in 2023. The United States recorded 884 cases across 30 jurisdictions in early 2025, a 210% increase over 2024. Europe recorded 127,350 cases in 2024, the highest in 25 years, with Romania accounting for 87% of the European total and at least 30 deaths. What makes measles uniquely dangerous, beyond the fever and pneumonia risk, is what it does to immune memory. The virus destroys the cells that store the body's record of every pathogen it has previously defeated, erasing up to 73% of pre-existing antibodies. A child who survives measles can spend 2 to 3 years functionally immunologically naive. Pneumonia develops in 1 in 20 cases, encephalitis occurs in 1 in 1,000. A rare complication called subacute sclerosing panencephalitis, appearing 7 to 10 years after infection, causes fatal brain degeneration. Polio. Polio was on course for global eradication. Wild type 2 was declared gone in 2015. Wild type 3 followed in 2019. The remaining strain, wild type 1, persisted only in Afghanistan and Pakistan, where conflict made vaccination campaigns impossible to complete. Then a second threat emerged from inside the eradication program itself. The oral polio vaccine uses a weakened live virus. In communities with low coverage, that weakened virus can pass from person to person, accumulating mutations that restore its ability to cause paralysis. Gaza had been polio-free for 25 years. In August 2024, a 10-month-old child was paralysed by this mutant strain, directly linked to the collapse of sanitation infrastructure and the displacement of 90% of the population. Indonesia confirmed 7 cases. New York recorded a paralytic case in an unvaccinated adult in 2022. The damage is permanent. The virus targets motor neurons in the spinal cord, and once destroyed, the muscles they controlled do not recover. Death occurs in 5 to 10% of paralytic cases when the infection reaches the muscles controlling breathing. Whooping cough. Whooping cough kills infants. The bacterium Bordetella pertussis produces a toxin that paralyzes the cilia lining the airway, preventing the lungs from clearing mucus. Coughing fits become so violent that infants under 6 months can stop breathing entirely. The United States recorded 35,435 cases in 2024, a 5-fold increase from 2023. England recorded 14,905 cases, a 1,641% increase. 6 infants died in the United States, 10 died in England. The current vaccine generates immunity that fades within 4 to 7 years, meaning vaccinated adolescents and adults become susceptible again and circulate the bacterium without recognizing their own symptoms. A newborn cannot receive the pertussis vaccine until 2 months of age. The standard protection is vaccinating the mother during pregnancy, so antibodies cross the placenta before birth. In the United Kingdom, maternal vaccination rates dropped from 74.7% in 2017 to 58.9% in early 2024, removing that protection from tens of thousands of newborns. Syphilis. Syphilis cases in the United States fell to near zero at the turn of the century. In 2024, the country recorded 3,941 cases of congenital syphilis, the form transmitted from mother to infant during pregnancy, a 696% increase over 2015. The disease progresses through 4 stages if untreated, from a painless sore to cardiovascular damage, blindness, and destruction of brain tissue. Congenital syphilis passes through the placenta and can cause stillbirth, bone deformities, and meningitis in surviving infants. The resurgence has been accelerated by a shortage of benzathine penicillin G, the only recommended treatment for pregnant patients. The sole manufacturer experienced production constraints and a contamination recall, disrupting supply for thousands. Federal funding for sexual health clinics declined across the same period, cases were rising, reducing access to testing in the communities most affected. Scarlet fever. Scarlet fever was a major killer of children before the 20th century. Penicillin reduced it to a manageable nuisance. A strain called M1 UK has changed that. This variant of Streptococcus pyogenes produces nearly 10 times more of a toxin called streptococcal pyrogenic exotoxin A than the strains that preceded it, triggering an uncontrolled mass activation of the immune system that causes the sandpaper, rash, swollen strawberry tongue, and in severe cases, toxic shock. The United Kingdom recorded its highest scarlet fever incidence in nearly 50 years in 2023, at 33.2 cases per 100,000. China saw a major resurgence in 2015. Hong Kong recorded a 10-fold increase over its baseline in 2011. The disease remains treatable with antibiotics, but the same strain is also responsible for rising cases of invasive Group A streptococcal infection, where the bacterium penetrates deeper tissue and produces outcomes that antibiotics alone cannot always prevent. Dengue fever. Dengue fever had its worst recorded year in 2024, with 14 million cases and 10,000 deaths globally. Local transmission was confirmed in Florida, California, and Texas. The virus exists as 4 distinct serotypes, and the interaction between them is what makes it particularly dangerous. Infection with one type confers lifelong immunity to that type but creates a specific risk with the others. When a person encounters a second serotype, antibodies from the first infection carry the new virus directly into immune cells rather than neutralizing it, amplifying replication and triggering dengue shock syndrome with vascular leakage, organ failure, and a fatality rate that can reach 20% in severe untreated cases. There is no specific antiviral. The geographic range of the primary mosquito vector has expanded northward as average temperatures have risen. In Niterói, Brazil, releasing mosquitoes infected with the Wolbachia bacterium reduced dengue cases by 89% compared to surrounding areas during the 2024 national epidemic. Leprosy. Leprosy is classified as a neglected tropical disease, yet Central Florida accounts for nearly 1/5 of all United States cases. The bacterium targets peripheral nerves and the cooler regions of skin, progressing over years before visible symptoms appear. Early signs are skin patches that have lost sensation. As nerve damage advances, hands and feet lose the ability to detect pain, leading to repeated unnoticed injuries, secondary infections, and the gradual shortening of digits through tissue reabsorption. The 9-banded armadillo is the only other mammal known to carry the bacteria naturally, and transmission through contaminated soil has been identified in gardeners and landscapers with no travel history to endemic regions. The United States recorded 205 new cases in 2024. A significant diagnostic delay compounds the problem. Because the disease is so strongly associated with the distant past that clinicians frequently do not consider it, allowing years of irreversible nerve damage before treatment begins. Scurvy. Scurvy is caused by vitamin C deficiency severe enough to prevent the body from forming functional collagen. Symptoms begin after roughly 1 month of consuming less than 10 milligrams of vitamin C per day, well below the amount in a single orange. The condition progresses from fatigue and small skin, hemorrhages to bleeding gums, painful bruising, and wounds that will not close. In the United States, scurvy in children tripled between 2016 and 2020. Among child cases, 65% involve children with autism spectrum disorder, where extreme food selectivity restricts intake to a narrow range of processed food. Bariatric surgery patients develop deficiency through malabsorption. Adults in low-income households without reliable access to fresh produce develop it through sustained reliance on calorically adequate but nutritionally depleted food. Patients frequently undergo bone marrow biopsies to rule out leukemia before a dietary history reveals the actual cause. The treatment is vitamin C supplementation, with recovery beginning within days. The disease returned not because the cure became unavailable, but because the conditions that originally produced it came back in a different form.